Welcome back to CTV Morning Live. It's time for our Ask the Expert segment. Dr. Bernie Lalonde is joining us from the Chrysalis Rejuvenation Clinic. We're going to be taking your calls on the air, 789-6559, extension 2803. You can always send us a question via email, ottawa.morning@ctv.ca, or check us out on our new Facebook page, CTV Ottawa Morning Live. Great to see you again.
Nice to be here.
All right, so it's almost it's like, what's the topic we're hitting on today? And we're looking at thermage, which a lot of people are going to look is almost like a skin tightening machine or device. Or
yes.
You'll explain it, and then also fillers.
Yes.
Want to start with?
Well, you know, the nice thing about both of those technologies is that they're complementary. So you can do fillers and you can have thermage either the same day or the next day, and the results are complementary. So you're going to get a much more sort of a wow effect, as it were. But thermage is a non-surgical skin tightening device. So it's out there as a one treatment modality. In other words, you don't need a series of treatments, but you need one treatment. Occasionally some people come back after 6 months or a year for another treatment. But what it does, it stimulates the collagen cells to form new collagen. So by doing that, it's a slow process. You've got to be patient because results, you probably won't see anything at 1 month. Sometimes you start seeing them at 2 and 3 months, and you certainly see them much better at 5 and 6 months. And at a recent meeting, two of the dermatologists that were talking about this said that they find that the results even get better at 1 year. And that's been our experience as well. So patience is the key. The nice thing about thermage, no downtime. So you have it done, you're at work the next day. There's no redness, there's no swelling. Well, you know, as opposed to some of the other lasers that we do, you know, where people have to take some time off work or social time off. Thermage has none of that. I might add, it's a bit uncomfortable. You know, so you've got to be able to tolerate a bit of heat. But we do give medication, and I highly recommend that for everyone. But the machine you can adjust it, obviously. So the patient has to feel heat, but shouldn't feel intense pain.
And it's got to be tough to be able to say to a client, you're coming in for a procedure. Don't expect to see this altering look or change for a longer period of time. Is that difficult sometimes to be able to convince someone that it is worth having it and waiting for the cells to, for the collagen to reproduce itself?
I think it's a very good question and a very good point because, sometimes in talking to the patient, I can see that they want an immediate result.
Instant gratification.
That's right. That's right. And you know what? If I sense that that's all that they're looking for, I try to steer them away from thermage because you have to be patient, okay? And if you're not patient, you're probably not going to be pleased. That's why the combination with something like fillers is also very nice because particularly if you're doing thermage for the face where you're addressing the jowls in particular, and I think we're probably going to have some pictures coming up that illustrate that.
Put some on.
In this case, you can see that on the left-hand side, the before shot, she has the jowls on the border of her jawline, and the picture on the right is about 4 or 5 months post, and you can see it's tightened up. Now, if you added a bit of filler to that in the cheeks, she would have an absolutely wow effect right away. But this is a very real patient. This isn't a model. This is a patient in her 50s. And that's the ideal age group. Somewhere between 35 and 60 is what I like to do for thermage. I think over 60, 65, probably the collagen has already been stretched out so much that it's not going to have the greatest effect. Now, this is also very good for men, and we've done a number of people for men. And in this case, you can definitely see a significant difference. Again, on the jowls, on the nasolabial folds, the whole cheek area has been tightened up. Yeah.
Absolutely. Now, we're looking at these in terms of the face, but when you're looking at skin tightening, you could be looking all over the body, and for a lot of women too. Even can it move down into the abdomen, into
Absolutely.
the stomach, into buttocks?
Well, the face is number one. That's the commonest. Number two is actually eyes, and number three is abdomen, in the order of prevalence of people seeking that. But we've done arms. The other day I just did thighs, and I did buttocks. There's actually a specific tip for cellulite. And so cellulite, as our listeners may know, is basically a dimpling of the skin. And so thermage helps to relax the fibrous bands that cause the dimpling, therefore making a smooth appearance. So it does not reduce fat, and I should tell people that.
That's it. Don't expect this isn't a weight loss. Can we get that picture back up again in terms of the skin fold on the stomach? Because that picture right there is a drastic change.
Now, I mean, this is what I call a home run, and right. Quite honestly, I don't want to put it out there that everybody gets this spectacular result.
Because this is a very fit person that you see, so that's just skin from pregnancy, from or
exactly
weight
right.
loss.
exactly right. This is somebody who's had 2 or 3 kids, and she works out. She's down to her ideal body weight, but she's got this loose skin. And now with the thermage procedure, that skin is tightened up. So I tell people, it's not reducing fat. You have to be at your ideal body weight. So if you're on a weight reducing diet, lose the weight before you do the thermage. Once you're in that range that you've considered your ideal weight, that's the time to have it done.
Okay, that's amazing to see some of those before and afters. Okay, so that's a great look right there at the thermage that we were seeing. Fillers can be done at the same time, you're saying?
Well, or very close, either if not the same day, the next day, or the day before, anything like that. Fillers, the 2 brand names that we use in our clinic are Juvederm and Restylane. They occupy 95% of the Canadian and North American market. The nice thing about fillers is that you walk out of the clinic with a look. So if you come in and you have sunken cheeks, or you have folds from your nose down to the corner of your lips, or from the corner of your lips down to your jaw, those are the common areas. Well, they can be filled, and you can walk out of the clinic with a look. So obviously people love that. It's instant gratification.
Absolutely. We have to take a short commercial break, and I know there's lots of questions and so forth, especially at your clinic afterwards. So we'll take a short commercial break, and we'll be back with more with Dr. Lalonde and the Chrysalis Rejuvenation Clinic right after this.
Doesn't mean no more, but